Okay, so this is our traction wedge that we're gonna give you around your third visit, or when we really feel that adding this to part of your at home is gonna be the best suited for you. So you are gonna get one of these in the office, and we're gonna show you exactly how you're gonna be using it in terms of which base that specifically is gonna be the best for you. So for me, when I do traction, I'm gonna take this bottom base off, and so I'm gonna be using it with just this base here. For some patients, we're gonna do it with none of the bases on here, or some of them are actually gonna be 3 stacked. So I'm gonna demonstrate exactly how we're gonna set up in this position. We do walk you through this in the office. This is just a good refresher as to how we can set ourselves up for traction. So it needs to be done on a firm surface. I'm gonna put that traction wedge on the ground. What I'm gonna do is that label, as you can see, is pointing away from me. We're gonna lift our head up, we're gonna squeeze and push that traction wedge all the way to where it touches the base of the neck. I'm gonna hold that in position as I'm letting my head extend all the way over the back of it. So nice and low on the neck. You can tell that the back of my head is close to, if not touching, the surface that I'm laying on. Once I'm in this position, this is the extent of what we're doing. We are gonna shoot for 10 to 12 minutes, ideally, to really develop that cervical curve, stretching and relaxing those muscles that develop over tight and over pulling in the front of the neck. So when those 10 to 12 minutes are up, how we get off of this is very important. You're gonna physically lift your head with your hands to this position, kind of where that chin comes up. Once you're here, you can take your hands off and you can roll off to your side. So 10 to 12 minutes, we're shooting for 5 days a week with our cervical traction.